Hello, I'm Dr. Joseph Wu from Stanford University. I'm the immediate past president of the American Heart Association, and I'm here at our annual AHA scientific meeting in Chicago. I'm also here with our esteemed guest, Dr. Chloe Wilson, the senior editor at Lancet. Chloe, welcome for being here.
Thanks ever so much for having me here, Joe. It's great to be able to talk to you today.
Thank you so much. So I want to start, Chloe, by asking you your background and how did you get into the Lancet journal?
Well, thanks very much. I mean, it's actually something people are often very curious about when we meet, and how I got into editorial, because my background is actually as a clinician. So I worked in the NHS for 5 years, and I did academic foundation program training, which is basically after you finish medical school in the UK, you do 2 years of kind of general medical training, and as part of the academic program, you do research and things as part of that. So I was involved with some of the major trials of the CFTR modulators with cystic fibrosis, and it kind of really gave me an interest in research and the academic side of things, as well as the clinical. And then I worked in the hospitals all throughout COVID, which you know, was quite a difficult time actually as a young doctor. And then I transitioned into the community, working as a GP, so a general practitioner, which I guess is like family medicine in the UK. And you know, if I'm totally honest, I kind of lost a bit of my passion for medicine and why I was a doctor. Then I felt like I often just wasn't able to give the care that I really wanted to, and I was looking to be able to do something on a bigger scale and kind of influence care from a different perspective, because I felt like I wasn't able to do that working within the care systems in the UK. And you know, I'd seen a lot of inspiring papers from the Lancet throughout COVID. You know, we published some of the first studies in those first cases, and I thought, wow, I mean, that would be an amazing place to work. So when an opportunity came up in an editorial role, and it was a more junior one than I'm in now, I went for it, and honestly, it's been the most fantastic transition. So, I mean, I guess it's a bit different because starting at the Lancet was, you know, the first step really in my editorial career. And it was amazing because some of the work that we do, you feel like you really have a chance to make a difference on a much bigger scale than I felt like I could as a GP. So.
Well, congratulations on that. I mean, it sounds like you have a dream job. And so maybe you could tell the audience a little bit about your day-to-day activity as a Lancet editor, because we have a lot of people in the audience who would love to submit their paper to Lancet.
Yeah, and I mean, the first thing I would say that I think journals get a bad reputation as being unfriendly, and I've been on the receiving end of it. You know, it's not very nice when you have a paper rejected, but we are real people, you know, on the other side of it, and we're always really happy to have any pre-submission inquiries, and I'd always really urge people to email us and get in contact with us. You can find all of our details on the website. If you are interested in submitting something, whether that's research or whether it's something more like a comment or an opinion piece, it's always really good to have a discussion with the editor beforehand, so that you know, you can find out if it's something that they're interested in. And I suppose my role, I've got several different roles, but because of my medical background, I do a lot of our commissions and series, which are these large bodies of work which aim to sort of close a gap within a neglected area of health, as well as the peer review and the research side of things, which I've become one of our cardiology ambassadors with my colleague Flavia Geraldese. So we mainly focus on the research side of things in cardiology, and it's obviously such a huge field with so much going on there. It's fantastic to have two of us that we have lots of conversations with people, you know, about their research, and if it's maybe something that we'd publish in the Lancet.
Wow. Well, you know, from the audience here, you heard from Chloe that she's very, very accessible, so feel free to reach out to her if you have any questions about your pre-submission inquiry. Now, Chloe, tell us about this AHA meeting this year. What are some of the exciting stuff that you're seeing at our meeting?
Well, I mean, it's actually my first time at AHA, and it's been a fantastic meeting so far. I've had a great time, and it's the first time we've actually had a Lancet session, I believe, at AHA, and that was fantastic. And thank you so much for the opportunity for giving us a session where we covered obesity and cardiovascular outcomes, which I feel, you know, is the topic of our, you know, of our generation. Really, it's going to be a conversation that keeps going with all of the new medications that are coming out, but how those also fit in with the other aspects around obesity and, you know, the obesogenic environment. So I mean, you know, the big trial which I think people were excited about is Summit here, and it's great to see that tirzepatide, you know, is improving cardiovascular outcomes too, and it's really nice to see, as well as the symptomatic improvement, to actually see you know, outcome data too. And I feel like those conversations around obesity and cardiovascular disease, you know, has really highlighted the importance of prevention. Because I also really liked the BP Broad trial, where they were looking at intensive blood pressure management. And you know, I feel like there's a lot that you could talk about with that, because you know, the change in the guidelines of having lower targets for blood pressure is really interesting, and that's something which I think is, you know, within a lot of the cardiovascular medicine, it's relevant to all of these aspects across different specialties, because you know, a lot of the people, at least in the UK, who are managing hypertension, they're going to be your primary care physicians. And it's a really interesting balance that I think that trial showed between, you know, getting a lower blood pressure of 120 millimeters of mercury, but then the risk balance of the side effects, because people did have more hypotension and hyperkalemia. So, you know, it really emphasizes that people do need monitoring with, you know, with more intensive strategies, and finding ways that we're able to give people good care, but then also monitor them at the same time. There's been lots of really great and interesting conversations around that.
Well, this is very insightful. So I want to thank Chloe for being here, and I look forward to seeing you next year at AHA in New Orleans. And I also look forward to having our audience members submit their papers to Lancet, so we could discuss more next year at the same time here. And thank you very much, everybody, and thank you, Chloe, for being our guest today.
Thank you so much for having me, Joe. And like I said, please do feel free to email me at any time with any inquiries about any papers, or as well as kind of more opinion-based content, because we'd really love to hear it.